fundamental level in LSI, value-based healthcare, this is what it looks like. So you, the patient, comes in, you let us know what has happened to you, why you're there, what you're wanting out of that, out of the medical care we're going to be offering. So you may say you've got a lot of pain, you can't do your job anymore because it's quite physical, and you're not able to help with the kids at home. So we understand those things. We then do our assessments to make sure we understand from a medical point of view what needs to happen to be able to facilitate that. But we then get onto the phone with you sitting there, we talk to the employer. So we understand exactly what the issues are at work, make sure the employer understands what your issues are, so that we're all talking the same story. We then get on the phone to, so for example with the employer, if we can't work that out because it's just too complicated or we can't get hold of the right person, the OT will then go and do a work visit. You'll go with the OT, your supervisor will be there, everyone needs to talk together about what are the practical steps of when you're going to be able to return, can it be accommodated for a while, when would you get back properly? And let's all get into agreement, we put it onto a document, it gets signed, and the employer, everybody has that in writing, so we're all on the same page. The therapist will also be communicating with the doctor that's referred the patient through, or maybe an allied doctor. Maybe you're also seeing a psychologist at the same time, or there's somebody else that's involved that needs to be involved in that conversation. The therapist will get in contact with them, make sure that you're involved in those conversations as well. So we're all on the same page as to what the game plan is to get you back playing. And all of that gets documented, and you get reports on it, and there's complete transparency in terms of what we're all trying to do. Those reports all go through to the funder, and that funder deciding if the value added to you is enough for what they paid is kind of where things are at the moment, is to be able to try and facilitate that and get that calculation right so that funders can see that by offering you the best value and getting you back to doing what you need to be able to do as quickly as possible, that the quality is high and that we can keep the costs down low.